Welcome back to the show, everyone. Today we're diving into a topic that touches so many families, educators, and communities, understanding how pediatric occupational therapy can truly transform the lives of autistic children. Joining us today is Karly Smith, an incredible pediatric occupational therapist who specializes in helping kids to navigate sensory processing, daily routines, and self-regulation. Karly, thank you so much for being here with us today. Would you like to introduce yourself to the general public?
Yeah, that would be great. Thank you guys so much for having me. I love what you do on your podcast and through your foundation. So it's an honor to be here. So my name's Carly. I'm an occupational therapist, of course. But outside of that, I'm a mom of two kids, a 3-year-old and a 5-year-old. So they're at very fun but very busy ages. I love to cook and read anything I can get my hands on and pick up lots of other little random hobbies that I do for a month and then drop. Um, and yeah, we love being outside at my house and just being in nature. So that's a little bit about me. Right now, I work in outpatient pediatrics, but I've worked in schools in levels as little as preschool and as high as high school. Um, I've worked in people's houses, I've done consulting. I've really worked in a wide variety of settings as an OT for 9 years.
Yeah, that's incredible. And to start us off, could you share a little bit about what drew you to pediatric occupational therapy specifically, and what a typical day looks like for you working with kids on the autism spectrum?
Absolutely, I would love to. I didn't know exactly what I wanted to do out of high school, but I knew 100% I wanted to work with kids. I thought maybe speech therapy, I thought maybe teaching. I shadowed people, but nothing quite felt like a good fit for me. I ended up volunteering at a residential center for children with visual impairments and complex disabilities and ended up meeting the OT there. And I really had never heard of OT before this. So I loved talking to her. She allowed me to shadow her, and I just fell in love with what she did. I still keep in touch with her today because she is probably the number one reason I went into OT. But I just thought, wow, it is such a cool career to be able to help kids work on the skills they need and want to do in everyday life. Like, what could be a cooler job than helping kids play? I couldn't believe it was a real career. And the more I learned about it, the more I loved. I was absolutely hooked. And really, the more I learned about the sensory systems and sensory regulation, the more I dove into like my own sensory systems and sensory regulation. So I think OT is a field where you can just keep learning every single day. So it's a very special field to me. A typical day for me working with autistic children right now, I'm working in outpatient. So I see kids for about 60 minutes typically, and we work on a really wide variety of skills. So, OTs can work on fine motor skills, visual motor skills, visual perceptual skills, um, executive functioning skills, things like problem solving, initiating a task. Um, we work on obviously the sensory regulation piece, which is such a wide variety of things. So you'll find us in the sensory gym, on the swings, on the trampolines, climbing and jumping. I also do feeding therapy, which can be for sensory reasons or for oral motor reasons. So the cool thing about the OT field is that our scope includes a lot of activities of daily living and feeding and playing, but you can really hone in on what you're interested in and what your clients need from you and dive deeper into that.
Yeah, that makes so much sense. Now, when people hear the word occupational, they usually think of adult careers or jobs. How do you explain the concept of occupation when it comes to young children with ASD?
This is a great question because I get this question all the time, like, oh, are you like a PT? Or, oh, do you help people find jobs? And really, Occupations just refer to anything that occupies your time and gives your life meaning. So for adults, that could be work, but most of the time in OT, it's things like household chores or driving or cooking. For kids, their occupations are playing and learning and eating, sleeping, dressing themselves, making friends, participating in family life or daily routines. So my job isn't to just teach kids like isolated fine motor skills because they look impressive or check a box. It's to help them integrate those skills, to help them participate more successfully in things that matter to them and matter to their families in their everyday life. And again, I know I've said it before, but like it is so fun to help children play and help children do the things they want and need to do using play.
Yeah, for sure. That frame of reference is so helpful. Play and daily routines really are a child's main job. Let's talk
Mhm.
about sensory processing. Because sensory differences are a major part of life for many autistic individuals, what are some of the most common sensory seeking or sensory avoiding behaviors you see in your sessions?
Sensory seeking and avoiding is a huge reason that people seek out occupational therapy. And before we dive into it, I want to point out that that sensory processing is so incredibly individualized. It can vary greatly, even within the same person. What they need 1 hour or 1 minute isn't always what they need or what they seek the next moment. So some children may seek input, and that can look like spinning or jumping, crashing into the couch cushions at home, chewing on things like their shirt, touching everything. A lot of times in schools, you'll see the kids like touching, trailing their hand down the wall in the hallway, or just constant movement. Whereas avoiding can often look like just avoiding situations altogether, maybe experiencing that withdrawal, um, covering ears, refusing to wear certain clothes, like many times it's clothes with tags or socks with seams, avoiding messy play. So I have a lot of kids that hate glue. Um, or even just becoming really distressed in loud environments. So, those kids that have a really hard time in the cafeteria or at a school assembly. Some children seek this sensory input because it helps their nervous system feel more organized and it increases their body awareness. Other kids avoid certain sensations because those experiences feel overwhelming. Some children and adults even express that these sensations can feel painful to their brain or body. I think the important thing to remember about these behaviors when we're observing them is that they're always communicating something. So people might be asking, well, how do I stop this? And instead, I like to ask kind of what is the child teaching us about their nervous system needs? We're not seeking to stop this behavior, especially if it's not harmful, but how can we give the nervous system, how can we give this child what their body is needing at that moment?
Yeah, it's fascinating how differently every child's nervous system responds. Following up on that, parents often struggle to figure out what's actually driving a tough moment at home. How do you help parents figure out the difference between a sensory related meltdown and a standard behavioral tantrum or reaction?
There's definitely overlap with the two, and they can look pretty much the same sometimes. It's really not always possible to know with certainty, but so many parents are trying to do what's best for their child and really trying to figure out that why. In general, I try not to jump straight to labeling, but a sensory meltdown tends to happen when a child or a person's nervous system becomes just really overwhelmed beyond what their brain can manage at that moment. This can be something really big, like the fire alarm is going off, or it can be something small that really nobody but that child can pinpoint. Often I like to describe sensory regulation as a cup. So we don't know how much quote unquote water is in that cup, but they could have a little water added because there's a tag in their shirt, and then a little more water added because their routine was just a little bit off this morning. And then thing after thing after thing happens, and then, an unexpected noise happens in class, and boom, a pencil drops, and we're in meltdown. So we can't always assume we know the why behind the meltdown, but what we need to know at that moment is that this child is not choosing this response, and consequences and rewards are not going to change anything in the moment. The brain is literally offline and it's unable to respond. Whereas a tantrum, I think the word tantrum in and of itself has just this negative connotation because I think people tie it to this like magic toddler manipulation. So I try to stay away from the word tantrum in general, but tantrums typically have more of a goal behind it. I didn't get X, so I'm trying to communicate frustration to you because I didn't get what I wanted or because I am not able to make this choice. So when I'm working with parents who are struggling with making that distinction, I think instead of asking which one is it and trying to figure that out, we try and shift to a model that's more, what does this child need right now? What are they trying to communicate to me? Whether they're feeling overwhelmed or frustrated or anxious or disappointed, the response should focus less on like, is it tantrum or meltdown, and more on how can I help them feel safe and regulated so we can shift into teaching. Because we can't learn when our nervous system's all out of whack like that.
Yeah, even though the difference between a meltdown and a tantrum isn't like black and white, the distinction is still really crucial for parents.
Yeah.
A lot of symptoms overlap across neurodevelopmental conditions too. How do the sensory processing challenges in kids with ASD usually differ from or compared to what you have seen in kids who only have ADHD or sensory processing disorder, SPD?
Yeah, as much as me and the DSM would love it, the diagnoses don't create these nice, neat boxes when it comes to the sensory processing piece. There's so much overlap, and we see different patterns of sensory processing needs across diagnoses of, like you mentioned, ASD, ADHD, SPD. There's even OCD is really common amongst this group of neurodivergent disorders. So ADHD typically involves challenges in filtering sensory information because of the differences with attention and regulation. I think most of the time when people think ADHD, they think of the pattern of sensory seeking and kids that seek a ton of movement. And this is sometimes in an attempt to generate that dopamine cycle. I think ADHD gets this reputation for being movement seeking because it's the most commonly observed type. But with many people with ADHD, traditionally more women who aren't always captured in research, they experience more sensory overwhelm. In some literature, they've explained it like, oh my gosh, my brain can't process one more thing. So they get really easily overwhelmed by sensory input. Autistic sensory differences often, but not always, involve actual perception and processing of sensory input. So they might feel certain sensations deeper, or they might miss other sensations um, because they're feeling certain other things more intensely. So this can lead to neurological dysregulation and hypervigilant states because they're constantly looking for something in the environment that could dysregulate them. Sensory processing disorder is not currently recognized as its own diagnosis in the DSM, but sensory processing differences absolutely exist and are absolutely valid and can significantly impact the daily life of a person, regardless of their diagnosis. As an OT, at the end of the day, I'm treating the child's functional challenges and looking at their sensory profile as a whole and understanding that it might not fit into a diagnostic criteria perfectly, but that's what a skilled OT is good at, is just looking at a child or a person for what they are and who they are right now.
Yeah, that overlap can definitely make things tricky to navigate. But when people picture an OT clinic, on a separate topic now, they might picture a room full of swings, weighted blankets, and tactile sensory bins. What is the actual goal behind using these tools during a sensory integration therapy?
I actually love this question because I think OT is kind of known for our tools, like you said. And sometimes it's the most misunderstood part of occupational therapy. People see a swing or a sensory gym and they think, oh, they're just playing. Or they see a fidget or a sensory bin and they just call it sensory. But it is so much more, it is so much deeper, and it is so much more skilled. Just because kids are having fun doesn't mean they're not building these skills. In fact, kids learn better and more effectively through play. So the therapy is the clinical reasoning behind how, when, and why we use these specialized tools. And every activity is chosen by an OT because it provides a specific type of sensory input and creates what we call the just right challenge. And that is basically something that's challenging enough to promote learning, but not so difficult that a child becomes overwhelmed or too frustrated to the point where they want to disengage. So you brought up tactile bins. So, for example, a child who has decreased body awareness and interoceptive awareness, we might use a tactile bin to help them experience and discuss what our hands feel like in the bin. We might also use the same tactile bin to develop fine motor skills, to dig up hidden puzzle pieces with little tweezers. We might use the exact same tactile bin to build executive functioning skills by planning which animals we're going to get first, next, and last, and then introduce some problems into that equation. So as OTs, we're trained in sensory integration. We're constantly observing and adjusting as these kids are playing or doing our activities. We're asking ourselves, how is the child's nervous system responding? Are they becoming more organized or engaged? Are they getting overstimulated? Do they need more movement, less movement, different types of sensory input? Do I need to grade the activity up to challenge them a bit more? We are constantly making these decisions moment by moment. So even when it looks like we're just sitting and playing, we are targeting these skills. And really, good therapy often looks like play because play is how children naturally learn. But behind that play is a tremendous amount of knowledge about child development, neuroscience, motor learning, sensory processing, and that therapeutic use of self that we learn about in school. So if we're doing our job well, it should look and feel fun, but there's a lot happening beneath the surface.
Yeah, so it's not just like playtime. Every tool has a specific purpose for their sensory system. Speaking of,
Absolutely.
yep. Speaking of daily challenges, transitioning between activities like stopping playtime to get dressed or to leave the house can be really hard for autistic children. What are some practical routines or visual tools you use to make those moments easier?
Transitions are really hard for kids and even adults because they require flexibility, shifting attention, being able to predict what's next, and a lot of times stopping something enjoyable before you want to. So I love making expectations visible instead of relying only on verbal reminders because it tends to be easier to process and we do a lot less badgering instead of saying like shoes on, shoes on, shoes on, holding up the pair of shoes or holding up the visual is just a more concrete way. It's there, it's in front of you. It's not like speech or language where it's there and then it's gone. So that could look like visual schedules, countdown timers, consistent transitioning objects, giving lots of advance notice and warnings, giving choices whenever possible. So instead of saying it's time to put shoes on, saying, would you like your red shoes or your blue shoes? Or do you want to put your shoes on inside or outside? and just building really consistent routines. Consistency and routines creates predictability, which when we talk about the autistic brain is typically very calmed by routines. So once we create a really effective routine, they know what to expect and they don't have to have that vigilant looking for danger brain. Just as important, I ask myself as a parent and an OT whether the transition I'm asking the child to do is reasonable. Sometimes I know as a parent I'm guilty of it too. We expect children to just stop immediately because we as the parent are ready. And a little preparation can make a transition so much more successful. I totally get this is just not possible every single time in everyday life. You know, you're trying to get out the door, you didn't have time to do all the steps, but I know when I'm in that situation, my children are most likely going to match my energy. So even if I can remain calm through my own chaos, that is one positive step that I can make.
Yeah, those are such practical takeaways. On top of sensory regulation, fine motor skills like writing or buttoning a shirt can also be tough for kids on the spectrum. How do you work on those physical skills while keeping the child engaged and relaxed?
So children obviously learn best with when they're engaged. You hit the nail on the head with that question. They need to be engaged and relaxed. So instead of, endless handwriting worksheets, we are typically building strength while we're climbing, while we're pinching clothespins during a silly little pirate game, using tweezers to rescue dinosaurs from the sensory bin, or creating an art project that they're really excited about. My goal is to let them lead, go based on their interest, and use my OT lens to address their goal areas. And one of the most important things OTs do is we look beyond the hand. So fine motor skills often just get this rap of fingers and hands, but as OTs, we know that we also need to be clued into a child's posture, their shoulder stability, their vision, their sensory processing, motor planning, attention, and motivation. So if handwriting, say, is difficult, I'm asking what's making this hard, and I'm looking at the whole child, the whole body, and not just assuming they need more practice with more worksheets.
Yeah, definitely. And therapy obviously doesn't stop when the 45-minute or 1 hour session ends. How do you collaborate with parents and teachers to make sure the strategies you use in the clinic carry over to their home and school?
This is a vital part of OT, and any good OT will tell you that the relationship you have with the parent is such an important part of therapy because parents know their child better than anyone else. So, my role isn't to hand them a list of things that they should be doing better or a bunch of homework for them to do, it's to partner with them. So, I spend a lot of time building rapport with not only the child but the parent. I like to explain the why behind what we're doing because, again, like when something looks like play and we're being really silly and playing with construction cars for 15 minutes, a parent is very valid to wonder, well, what are you doing? So it's much easier to build home programming and carry over strategies learned in therapy at home when parents understand the why behind it. When I'm thinking about a home program, though, I'm again not giving them this big long document with 100 things for them to do at home. I'm a parent too. I get it. I try to have realistic expectations. So if I suggest something that only works for a child in, like you said, my 45 to 60-minute session, that's not really helpful if it only works for them an hour a week. I had a mentor once that said if I went on a diet an hour a week, it wouldn't be a very great diet, right? So we want our skills to be generalizable to home. So my goal is to find strategies that actually fit into the family's life, no matter what that looks like.
Yeah, those generalized strategies are everything. As we know, autism is a wide spectrum, and no two kids are exactly alike. How do you tailor a therapy plan so that it respects each child's individual personality and strengths rather than taking a one size fits all approach?
I think the most important thing is to start by learning who the child is. I'm not just looking at a kid's name on the paper. I'm not just looking at a diagnosis. I want to know, what makes them laugh and what are they passionate about? What do they love to learn about? What feels hard to them? What matters to their family? What matters to them? What are their strengths? And these strengths aren't just something that we like throw in at the end of the evaluation. They're the foundation that I build my therapy around. So after we really establish our connection and those strengths, from there we can dive into the areas that we want to work on, those areas that are meaningful to the child and meaningful to their family. So, what routines are challenging? What's dysregulating to them? What do they really want or need to do that's tough for them right now? Let's figure out why it's tough and then build from there.
Yeah, I love that child led, strength based focus. With so much information and sometimes misinformation out there, what is one misconception or myth about pediatric OT or autistic children that you wish more people understood?
I think the biggest misconception is that therapy is about changing autistic children. That's 100% never my goal. It's quite the opposite. In fact, my goal is to help them feel authentically and joyfully themselves. My goal is to understand the child, reduce the barriers, keeping them from this authenticity and joy, and help them participate in things that are meaningful to them. And help their parents also understand them at a deeper level so they can further connect. That starts with curiosity. So instead of asking, how do I stop this behavior? How do I change this child? I want to ask, what might this child be communicating and how can we support them? Because I do feel like that shift in thinking can change a lot.
Yeah, definitely. And for the ASD project, that's like our mission. We don't want it to seem like it's a cure, but a way to help people. And that's such an important message. We also see a lot of overlap between sensory overload and severe anxiety or OCD in kids. How do you help tell the difference between sensory distress in an autistic child versus something like panic or anxiety?
Yeah, this is a great observation you made. There's definitely overlap and one can really influence the other. So a child who becomes overwhelmed by sensory input can often develop anxiety because they've learned that certain environments feel unpredictable or unsafe. And when they feel that they are not safe, our brain releases these hormones and neuroreceptors that trigger our fight or flight. And our brain doesn't just forget that. Our brain remembers. So, in one of my recent videos where I dive into research on my Instagram, we talked about how many neurodiverse people are in this constant state of hypervigilance because of their experience. They are constantly searching for things that could be overwhelming to them, and that's exhausting. Anxiety, in particular, can also heighten sensory sensitivity. So, these can make neurodivergent people feel things more intensely. OCD introduces an even deeper layer because the distress is often driven by intrusive thoughts and compulsions that the person feels that they have to do, or else they continue to feel dysregulated. So that can be really impacting everyday life and functioning. These two are hard to tease out, and rather than trying to separate them perfectly, I try to look at patterns. So, what is often the trigger if they can pinpoint it or I can? What often creates relief? So, in anxiety, we might see relief as just needing time or space or a calming environment, whereas with OCD, we might see that person having to carry out a compulsion, whether that is um, something like we would see in a stereotypical OT or OCD, like washing something or hitting a light switch a certain number of times, or reassurance seeking, or a ritual that they need to do in order to close that loop and feel calm again. Is the distress tied to sensory input, uncertainty, intrusive thoughts, or which is often true, some combination of all of those. So sometimes that means collaborating with psychologists or physicians or other professionals because no one discipline has all the answers. And I think working as a team can often be the best approach in these situations where we have multiple diagnoses.
Yeah, that breakdown really highlights how complex and unique every child is. To wrap things up today, what advice would you give to a family who had just received an autism diagnosis and feels completely overwhelmed about where to start with therapy?
I totally get the overwhelm. I think parents are given this huge evaluation, like 30 pages with pages upon pages of recommendations, and it feels like a very overwhelming process. So, first, take a deep breath. An autism diagnosis, first and foremost, does not change your child. It does not change who they were yesterday just because they got their diagnosis today. This gives you more information to help understand and support them and connect with them. And whenever you found this out, whether it's when they're 1 or 15, this can be really validating information for you and your child. So my advice is to try to spend less time worrying about doing every therapy perfectly and more time just getting curious about your child. Learn what helps them feel safe and what brings them joy. Follow their interests and just continue to build that connection with them. From there, we can really look at what therapies you're drawn to. So, looking in your area and talking to your physician about neurodivergent affirming therapies in your area, don't be afraid to talk to them. So, calling and asking to speak to an OT or a speech therapist or a clinical director about the approach that they take, really prioritize what matters to you in therapy and then go from there. And if you want them to walk you through what is speech therapy and what OT is, that's what they are there for. These people are wanting to help you. Just remember that progress is not making a child look less autistic. It's about helping them participate in life in ways that feel meaningful to them while honoring who they are. So find a community who supports this however you can. I've had parents connect through groups, play cafes. In my area, we have a We Rock the Spectrum that does a really nice job of connecting families. Having a community can really enhance how you process this and can give you a lot of people to lean on. You don't have to become an expert in autism overnight. You just have to keep showing up with curiosity and flexibility and, of course, love. But autism parents are seriously some of the most compassionate and strong people I have ever met. So, any parent that's listening to this podcast is more than likely doing an amazing job.
Yeah, that's actually like incredible advice. And Carly, this has been such an incredible conversation filled with so much clarity and compassion. Thank you for taking the time to share your insight with us today. Before we end things today, is there any last minute message you'd like to send to people before we wrap things up?
Yeah, I just want to say thank you. I mean, it's been great connecting with you guys at the ASD project. I really admire the work you do, especially with being young people and spreading this message. So I really appreciate you having me on. I would encourage people to check out my Instagram. It's Joyful Roots OT. I do a lot of research-based evidence reviews where I kind of break things down in digestible terms. But I'm just really, really passionate about creating a more inclusive world and spreading information about how to do that. So thank you for giving me an outlet to do it here today.
Yeah, thank you for being our guest. Our missions clearly align, and thank you so much to everyone listening. Be sure to share this episode with any parent, teacher, or friend who could benefit from understanding sensory processing and pediatric OT a little better. We'll see you next time, and all of Carly's information will be linked in our platform. Have a good day.